Okay, please, next slide. Okay. I want to share my knowledge about the side effect of stem cell therapy I had before in my experience. Thank you. 5 years ago, I spent a long time in one clinic, and I prescribed some bioregenerative medicine treatment for maybe for hundreds of patients. And I had good opportunity to follow up such patients. And I observed some side effects of these patients. One of the side effects, so-called side effects, was a huge antidepressive effect. Why I say that this is the side effect? Because we didn't expect such effect for that patients. They were treated because of the Parkinson disorders or Alzheimer's diseases, or they experienced brain stroke before and they were treated because of that. But so I want to say that they were treated because of the brain issues. And we prescribed some treatment focused on the brain regeneration. And once we follow up that patients, maybe 1 month or 5 months after that treatment, they almost everybody noticed that their depression gone, almost gone. It pushed me to start to delve into this problem and to study this problem a little bit deeper. And today I want to share my knowledge and experience how we can, what is the potential of the bioregenerative medicine for the depressive disorders. Okay? So this is my target, this is my aim of this presentation. What is depression? Of course, sometimes, from time to time, we have different mood. So this is the normal reaction. Sometimes we have good mood or lowering of our mood. This is not depression, this is not big issue. Or abnormal mood lowering, but not for a long time. This is also sometimes happening. Usually it can be caused by some reasons which I will show you on the next slide. But sometimes this abnormal mood lowering could be extended for a longer time, more than for 2 months, and it should be accompanied by some other side effects. This is what we call depression, and according to International Classification of Disorders, there are several forms of the depressions. It could be pervasive, persistent, and wide range of the symptoms, which I showed this slide. So, to establish the diagnosis of major depressive disorder, according to the DSM-5, a patient should demonstrate at least 5 or more following symptoms. And at least the duration of that symptoms should be at least for 2 weeks. But please make sure that there are no substances which can cause such symptoms. I mean some drugs or some external substances which can demonstrate such side effects. Persistent depressive disorder could be established if the duration of this mood disorder is longer than 2 years. So as you understand, changes happening in the brain tissue for 2 years, during these 2 years, are very huge. It is very hard to reverse such changes, but as I said before, according to our experience, it is possible. Again, please rule out the substance of the medical condition as a cause of such changes of the mood. So what are the obligatory and comorbid depressive symptoms to establish the diagnosis of depression? You can snapshot this slide and take it keep it in your mind. But I want to focus your attention that sometimes post-traumatic stress disorder could cause huge depressions. Who doesn't have post-traumatic stress disorder now? Okay, so it's very clear to understand that now we experience some changes in this world, in economy, in politics, even in climate changing. So that's why almost 100% of our patients or our audience are the potential clients of the depressive experience. What kind of medications? Today our patients consume a lot of medicines, and what kind of medicines or what kind of medication can cause depressive syndrome? Narcotics are on the first place. And also some treatment, non-behavioral or non-central nervous system treatment like steroids could cause some signs and symptoms of the depression. So we have to remember this list, otherwise we can establish this diagnosis wrong. Or even statins can cause some mood changes, and as Dr. Olha said before, and yesterday we mentioned about the incidence of heart disorders and statins consumption, and statins are the group number 1 of the medicines which are prescribed in the United States at this moment. Statins can cause some depressive signs and symptoms for several groups of the patients. And also, what kind of life situations can cause mood depression, mood changes or mood lowering, which is not the big issue. I mean, this is not the factor to establish the diagnosis of the depression. Some disorders like stroke or cancer or chronic pain or even type 1 or type 2 diabetes can cause the lowering of the mood for a long time, and that's why such patients can have not only physiological or functional changes of the brain, but also morphological changes of the brain. This is the very important, so that's why using the bioregenerative approach we can regenerate such tissues. To understand how regenerative medicine works for depressive patients, we have to understand what are the mechanisms of the occurrence and development of the depression. The main message I want to send to you is that depression is not only a functional disorder. Depression is also morphological changes in our brain. The vast majority of the publications say that the main theory or main hypothesis of the depression is the imbalance of the neuromediators. There are 3 main mediators which can modulate our mood. There are well-known dopamine, noradrenaline, and serotonin. And the combination of these 3 neuromediators, which are responsible, for example, dopamine for motivation, pleasure, and reward. Noradrenaline is responsible for alertness and energy. And in case of serotonin, it is responsible for compulsions and obsessions. So the combination of these 3 neuromediators can guarantee that our mood is good. But to be honest and to be scientifically more precise, the list of these neuromediators is much, much longer. A part of the serotonin, noradrenaline, and dopamine, we have to mention about glutamine and glutamate, gamma-aminobutyric acid, acetylcholine, and histamine. Please make sure that keep in mind that the synthesis of these neuromediators is happening in different cells, and different cells deterioration can change the concentration of these neuromediators. For example, well-known disorder like Parkinson's disease is characterized by the lower level of dopamine, which is synthesized in substantia nigra, but the same fact that substantia nigra can synthesize dopamine can explain why Parkinsonian patients have depression in 100%. Because dopamine will be low in this case, and these patients will experience some depressive signs and symptoms. Knowing this, having been saying this, we have to take in our mind that stimulation of the functioning of these or that cells, we can improve we can increase the concentration of the suffering neuromediators. What kind of symptoms and which cells could be damaged on this case? Talking about the serotonin, our patients can experience neuropathic pain, and it is characterized by the damage of the spinal cord. Serotonin, which is also well known like 5-hydroxytryptamine, is the neurotransmitter that is found throughout the body, but the main concentration of the serotonin could be found in the central nervous system, like in the white matter, and also I mentioned in my lecture yesterday that gastrointestinal tract, gut can synthesize, and especially gut microbiota can synthesize serotonin. So that's why our gut, our microbiota decides what mood will I have this morning or afternoon, depending on what kind of a meal I consume every day. Talking about the noradrenaline, it can regulate limbic system, which is responsible for our mood and for some hemodynamic effects also. It can regulate our blood pressure. So serotonin is responsible for our mood and can cause the the lack of serotonin can cause the depressive symptoms also. And actually the inhibitors of the reuptake inhibitors, serotonin drugs are one of the most widely used drugs nowadays for the depressive patients. I have mentioned already about dopamine. Let me say again that dopamine can stimulate decarboxylation of the desoxyphenylalanine, and that's why it can be involved in the regulation of the blood pressure and mood also. The same for glutamate, and saying all together and collecting all together, the main hypothesis and prominent hypothesis of depression are the next. The first is stress hypothesis. It could be caused by any stress, psychological or even physiological, physical or even severe disorder can cause stress, and thus after that this patient can experience depression. So if your patient experienced cancer or brain stroke or heart attack and some major surgeries, please don't be surprised if this patient will have afterwards some changes in the neurotransmitter profile. How to correct it? First of all, we have to treat the main reason of these changes, but also the correction of the neurotransmitter synthesis can be very helpful for such patients. Hypothesis of neuroinflammation. If you remember, yesterday I mentioned that leaky gut could be caused by inflammation. The same for depression. The main idea is that such depression could be found not only in the brain, but in any organ of our body. So gut inflammation can cause neuroinflammation. Neuroinflammation can cause heart inflammation, and so on and so on and so on. So any inflammation. So we don't have any local inflammation. Any inflammation in our organ is widely disseminated process. So this is the generalized process. In case of brain, if our patient experiences neuroinflammation, anti-inflammatory treatment is important for the treatment of such patients. You know better than me that any inflammation is accompanied by the cytokine storm. After the COVID pandemics, we are very familiar with cytokine storm, and now we know that there are some inflammatory or pro-inflammatory cytokines as well as anti-inflammatory. Taking it in our mind, we understand that anti-cytokine therapy could be helpful for the depressive patients. So in general, if we have more than one hypothesis, it means that we don't have any sufficient hypothesis. So nowadays, the hypothesis of the occurrence and treatment depression is quite complicated. It has some genetic predisposition. Stress can cause depression. Our social and environmental changes can stimulate depression. Imbalance of neurotransmitters caused by some damage of the neuronal tissue can cause depression. Cytokine storm and general inflammation also can cause depression. So, answering to the question, morphological or functional, we have to say that this is both morphological and functional changes. Brain regions which could be involved in the damage in case of depression. There are almost all lobes and tissues in the brain: frontal, temporal, parietal, occipital, cerebellum, hippocampus, as well as amygdala, which are responsible for our mood and emotional condition. Please don't forget about the role of gut microbiota and gut-brain axis. I showed this slide yesterday, and I think it's very good to show this slide once more again in this presentation. Why we consider that the depression is morphological? Because in case of depression, especially in major or pervasive and persistent depression, such patients demonstrate morphological changes in MRI and CT scan of the brain, as well as the post-mortem findings. So they experience and they demonstrate the histological and morphological changes, and this slide obviously demonstrates such changes. What are the conventional treatment of the depression? The number one medicine to correct the depression is antidepressant. And at this moment, nowadays, we have the second generation of antidepressants, which include selective and non-selective serotonin reuptake inhibitors. Unfortunately, their efficacy is not 100%. So that's why some other drugs can be very helpful in treatment of such changes. Cannabinoids and behavioral therapy and psychodynamic therapy, supportive therapy plays also very crucial role in this treatment. But unfortunately, only the first medicine, I mean serotonin selective and non-selective reuptake inhibitors, have high chance of the success in this treatment. And response rate is not more than 70% in case of electroconvulsive therapy and brief electrical stimulation of the white brain while under anesthesia. Of course, you understand that in this case, such patients and such treatment requires anesthesiologist and anesthesia care. So what is the evidence-based treatment for the emergent treatment? Here you can see the long list of the interventions which could be used at this moment, but generally I want to say that none of them demonstrated statistically significant improvements of the depression patients, because we have to use the complex approach, and none of them isolated using alone could not be effective for the treatment of the depression. Talking about the changes of depressive tissue on the subcellular and mitochondrial level, we have to say that such patients demonstrate mitochondrial and microRNA changes. And that's why RNA could be the target of the treatment of such patients, because RNA can improve neuroplasticity and survival of the damaged neurons, especially after the brain stroke. And also microRNA can stimulate the occurrence of new synapses, the genesis of new synapses, connections between different neuronal cells, which is very important for the development of the brain, especially in the younger age. Medical aims of the bioregenerative technologies include, but not limited to, the promotion of neurogenesis, repair of the neural damage, neural network integrity, and balance of neurotransmitters. How can we promote the neurogenesis? As Dr. Simon mentioned in his lecture this morning, we have several different types of the stem cells in our available today. The first one is the mesenchymal stem cells. Of course, I want to confirm that what Dr. Simon said this morning, that mesenchymal stem cells never could be converted to the neuronal cells, but using the paracrine effect and anti-inflammatory effect, mesenchymal stem cell treatment, not only stem cells itself, but stem cell peptides and other products derived from the mesenchymal stem cells, can demonstrate huge anti-inflammatory effect. And the promising results of in preclinical studies can demonstrate the effect of the mesenchymal stem cell therapy for the depressive patients. Unfortunately, these kind of the stem cells have limited potential for the depression, meaning that as long as you use these cells, the effect occurs. But using the mesenchymal stem cell therapy for the depressive patient, you can break and you can stop and break the vicious circle of the depression, especially when depression is caused by some accompanying or concurrent disorders. Number two is induced pluripotent stem cells, which are characterized by the organ specificity, and they can demonstrate a huge effect in terms of the improvement of the concentration of neuromédiators. Unfortunately, literature shows that induced pluripotent stem cells sometimes can demonstrate some side effects. So that's why we have to make sure that this stem cell therapy is quite safe, ethical, and the source of these cells is approved by the authorities. How can we change the functions of different brain or areas and tissues? You remember that our brain has at least 52 brain zones and areas which are responsible for the different functions and effects. Moreover, not only 52 areas, but more than 60 or almost 70 different types of cells could be found in brain tissue. Meaning that in particular disorder, for example, for patients with autism or for patients with Parkinson disorder, we have very good experience of the treatment of Parkinson disorder patients or Parkinsonism disorder patients. as well as dementia and Alzheimer's disorder, the necessary list of the cells could be adjusted and found, and we can use such cells in particular case. This is what we call personalized medicine. Remember, taking in our mind the functionality of different areas and brain zones, we can adjust the necessary list of the cells and or brain area tissues and peptides to stimulate this or that brain area. Number 2 medical aim is to repair neuronal damage. How can we target this aim? Using the growth factors. Different growth factors are available in the experiments as well in the preclinical and different clinical trials. So, for example, for the neuronal growth factors and vascular endothelial growth factors, we can expect different effects for the depressive patients. How can we stimulate the integrity of the neuronal network in the brain? As I mentioned before, we can stimulate the occurrence of the network using some electrophysiological as well as biochemical factors like transcranial direct current stimulation and biomodulation of the different areas and brain zones of using the behavioral therapy or social therapy. And balance of the neurotransmitters. As I said before, different areas and zones of the brain can stimulate different and produce different neurotransmitters. Knowing that, we can modulate the growth and activity of these or that areas of the brain and modulate the synthesis of different neurotransmitters, improving the mood and improving the signs and symptoms of the depression. Of course, this bioregenerative approach should be personalized, integrative, and taken into the account holistic view, so we have to treat not only one organ, as I said before, but also the whole organism. In conclusion, depression is the widely disseminated disorder. Depression is the severe health issue with the medical and social consequences. It's not only the problem of psychologists or psychiatrists. Depression is not just a functional condition or chemical imbalance. It's also characterized by the morphological changes. So that's why we have to correct such morphological changes. The next one is depression is not an issue of the brain, but of the whole body. We can notice some changes in gut, in heart, which are very specific for the depressive patients. Conventional medication and technologies need to be improved, and serotonin selective and non-selective serotonin reuptake inhibitors are number one, but unfortunately they cannot guarantee 100% efficacy of such treatment. And bioregenerative technologies demonstrate promising perspectives. We are only on the first stages of this road, so we have to collect more information and study it in a more professional and scientific way. Thank you very much for your attention. I am in time.